Okay, good evening everyone. Today we'll discuss the ECG. I'll read the ECG for you first. So this is a 12 lead ECG with a normal standardization, and the rate of the QRS is around 75 beats per minute. Okay. So because there are three large boxes. In the last class I told you 300 divided by number of large boxes gives the heart rate. Okay. So the rate is around 75 beats per minute. And what you are seeing here prominently, see the in the lead one usually the P wave should always be positive. What you are seeing here, the P wave is inverted in the lead one. Okay, so that is the most important finding. And what else, the even the QRS complex is inverted, and what else, even the T wave is also inverted. Okay, and one more unusual thing here, see the AVR is positive. Okay, so this type of ECG, when you see the P wave is inverted in the lead one with negative QRS complexes, always suspect two things. Number one is the limb lead reversal. Okay, number two is the dextrocardia. Okay, so always suspect these two things whenever you see a the P wave is inverted in the lead one. See, usually the QRS axis may change sometimes. Okay, because whenever there is some right axis deviation, then the QRS axis may change. But thing is, the P wave usually won't get inverted like that. Okay, so whenever you find a positive complexes in AVR and a negative P in the lead one with a negative QRS, suspect a limb lead reversal and a dextrocardia. Two things I told. But in the but one thing you should remember is in the limb lead reversal, this happens when there is a right arm to left arm. Suppose if the right arm electrode, if you keep over left arm and left arm electrode to switch to right arm, this type of ECG you can see. But in the limb lead reversal, the chest leads will be normal. Okay, see the chest leads will be normal. Now see this ECG here. What happened again? Same, the P wave is inverted lead one, the QRS complex is negative. Okay, but here what happened, just to see here the what happened to the precordial leads. In precordial leads, the R wave height is gradually decreased from V1 to V3, and also you can see some QS type of complexes with loss of R wave in the V5, V6. This is a dextrocardia ECG. Okay, so in the limb lead reversal, only the limb leads are affected, but the precordial leads are normal. The precordial lead transition is normal, and and the precordial leads are not affected. Whereas the dextrocardia, you will see the loss of R wave from V1 to V3, and you can see a QS type of complexes or a small R and a biggest type of complexes in the V4 to V6. That is a dextrocardia. Okay, so more to discuss about this limb lead reversal, what happens, and also, so here actually what happened is, see this is the usual axis, the Einthoven's triangle if we draw. Okay, so here this is the left arm and right arm, and this is the left foot. Okay, so these both are reversed here. Okay, so the AVF, which whose axis is pointed downwards, is not affected. Okay, so always remember, in the limb lead reversal, the AVF lead is not affected. So actually what we are seeing, AVL is nothing but AVR, and what actually we are seeing AVR is nothing but AVL. Okay, in the same way, what you are seeing here as lead 3 is actually a lead 2, and the lead 2 what you are seeing is actually a lead 3. Okay, so this you should remember. This is a limb lead reversal. It means the right arm to left arm and left arm to right arm electrodes, if you place if you don't place properly, this type of ECG you can see. And also I don't want to discuss here much on the arm to leg reversal also, but I'll tell much in very brief in order to avoid all the confusion. See this ECG. Yeah, see this ECG here. What happened, whenever in an ECG, if you find one lead completely like an isoelectric, see the lead 2 how it's appearing, it's almost like a isoelectric and very small complexes. Okay, so whenever you see these type of ECG with one lead showing like almost isoelectric line or a very small complexes of 1 millimeter, then always you suspect that the right leg electrode is reversed with some, the right leg electrode is either placed over the left arm or right arm. Okay, so always this you remember. So whenever in your next ECGs, when you see this type of the other all limb leads will have some complexes, but definitely one will have either totally nearly isoelectric line or very small complex. If you find, always again repeat ECG, recheck ECG and make sure that the leads are collected properly. Okay, and the left arm to left leg and left leg to left arm reversal is very difficult to identify on surface ECG unless you have an old ECG which is showing a normal connection, because you will think like some new left axis or some T wave inversions. Okay, that's a very difficult to recognize, but so this you always remember. Okay, so now we'll discuss this ECG. So this is what happened here. This is a precordial leads ECG. So this is a nice ECG actually. Precordial lead reversal. Here what happened? The V1 is reversed with the V2. Okay. So unless you identify this very carefully, you cannot appreciate this. So here I will tell you the findings. So this how to identify. See, whenever the transition should be gradual. Okay, so whenever you find something like this type of tall R in V1, okay, and again it becomes small r here, and again it becomes tall R here. So this type of transition whenever you find, always suspect that some of the precordial leads are reversed. And one more thing what you should identify is, see, the P wave in the lead V1, okay, is either a negative wave or it may be a biphasic wave. Okay, but here what happened, it is a positive wave here. Okay, so so that is also an indication that a lead V2 is reversed to V1. Okay, so the actual V1 you can see here. If you zoom it and see, you can see, can you appreciate this? It's not a completely positive wave, it is a biphasic wave. Okay, so this is one of the indication that the limb leads, the precordial leads are reversed. So you look at the transition and also you look at the P wave, and whenever you find something abnormal in the transition, always repeat the ECG. This is all very important because these new T inversions, new change in axis, you should not suspect a new abnormality. See, someone can give a casual look on this ECG without looking that the P wave is negative here. Okay, they may think that it's some lateral wall involvement, or suppose if they don't see this V6, they may think that there is some ischemia in the lateral wall. Okay, so always the limb lead reversal you should identify. So always have a look on the P wave. Okay, so this is the, so today we discussed the three things. One is the limb lead reversal from left arm to right arm reversal. Okay, so this is this one, and this ECG is the Dextrocardia. Okay, this is the Dextrocardia ECG, and there will be abnormalities in the precordial leads that you should identify. And this is the precordial lead reversal from V1 to V2. So this also we discussed today. That is the transition you have to observe, the P wave you have to observe, and this is the reversal from arm to leg involving the right leg. Okay, so whenever you find a one complex with a completely almost like a flat isoelectric line or a very small complexes, always identify this. Okay, thank you.